In this video, I'm going to tell you everything you need to know about canine mast cell tumors. Hi, I'm Dr. Vanessa Rizzo. I'm with Hope Veterinary Oncology Services, and we bring veterinary cancer care closer to home. Okay, before we jump into mast cell tumors, let's talk about what a veterinary oncologist is. Let's talk just a little bit about what cancer is, and then we'll talk specifically about mast cell tumors and how they affect dogs. So a veterinary oncologist is someone who did a lot of training after veterinary school. I got my veterinary degree at Western University of Health Sciences in Pomona, California. I then went on to do a 1-year rotating internship. That is a year of intense training where young veterinarians rotate through different specialties: surgery, internal medicine, neurology, dermatology, and a whole bunch of emergency medicine. I got that training at Garden State Veterinary Specialist in Tinson Falls, New Jersey. And then I was fortunate enough to be able to do a 3-year residency in medical oncology at Cornell University in Ithaca, New York. During a residency, we train under the guidance of experienced and already board certified mentors. We teach students. We have to do a research project and publish that research project, and we also have to pass multiple rigorous exams before we can become board certified veterinary medical oncologists. In order to understand mast cell tumor, or really any type of tumor, we have to first have a little bit of an understanding of what cancer is. So cancer is the overgrowth of one particular cell, maybe a group of cells, but essentially one type of cell kind of goes haywire. There's something wrong with the genetics of that cell. It's no longer listening to the instructions from the body or the rules it's supposed to be following, and it just starts dividing and dividing and growing and spreading to other places where it shouldn't be. That is essentially the definition of cancer. So if you have an overgrowth of a liver cell, you have liver cancer. And if you have an overgrowth of a bone cell, you have bone cancer. Mast cell tumors, M-A-S-T, is an overgrowth of the mast cell. So what's a mast cell? Mast cell is a special type of white blood cell that gets called into play when we're having an allergic reaction. So you have all these different types of white blood cells. They make up your immune system. The mast cell is just one of them. And when some people get stung by a bee or they eat a peanut, the mast cell sees that bee sting venom or that peanut as something foreign that needs to be destroyed. Mast cells contain granules or little bags of chemicals that contain histamine and heparin and other things that cause inflammation. And so when I eat cashews or when someone else gets stung by a bee, my mast cells see that as something that needs to be destroyed. And so they release these chemicals into the system that hopefully will destroy that foreign invader. Now, usually it just causes you a bunch of problems. Hives, swollen throat, low blood pressure, sometimes vomiting. Allergic reactions are varied in their clinical signs and varied in their degree of severity. Mast cell tumors can do all of that without the bee sting and without the peanut. These are cells that aren't following any rules in the body, so they can start releasing these chemicals without any cause, any reason. They just do it, and they can really wreak havoc on the body. Now, sometimes they'll release those chemicals right near the tumor. So if there's a little mast cell tumor somewhere on the body, you might see that area starting to swell up. It may turn red. It might get really itchy. And then the next day it looks totally fine because it stopped releasing those chemicals. Sometimes a mast cell tumor is really aggressive and it releases those chemicals into the whole body. And so the whole body is having an allergic reaction, not just little area in the skin. And that can be hives, itching all over, not wanting to eat because they're nauseous, Sometimes the blood pressure changes, it drops, and so a patient feels really lethargic and doesn't want to do anything. Mast cell tumors can really cause a lot of problems within the body. So how do you know if your dog has a mast cell tumor? Well, the majority of mast cell tumors are cutaneous, or they sit on the skin. Some of them are subcutaneous and they sit under the skin. But basically, either you, maybe the groomer, or your veterinarian finds a mass. Just having a mass or a nodule in the skin doesn't mean that your pet has cancer. That mass then needs to be tested, and that test is something called a fine needle aspirate, where a doctor will put a small needle into the mass or tumor, extract some of the cells out, put that on a glass slide, and then look at the slide under the microscope. Mast cells usually have a very distinct appearance under the microscope. Again, they're these round cells that contain all of these little granules that look like polka dots under the microscope. So if we see a cell that has all these pink and purple polka dots, we know that's a mast cell. And if we see tons of them, we know we have a mast cell tumor. This isn't just a normal mast cell in the immune system. If it was just a normal mast cell, we would see one or two of them. But if we're seeing clusters of 20 or 30, or we're seeing hundreds of them all over the slide, we know we have a mast cell tumor. So how worried should we be about these mast cell tumors? I mean, they are a type of cancer. They do have a wide variety of behaviors. So some of them will pop up on or under the skin, and they could potentially sit there for years and never cause a problem. And other mast cell tumors grow into these big baseball-size open ulcerated wounds. They spread to other locations, and they're constantly releasing those chemicals and making a patient feel really sick, to the point, we get to a point where we can no longer help them. What do we do about all this, and how do we know if the mast cell tumor is going to sit there for years or become this nasty, aggressive tumor that takes over the whole body? Well, when it comes to cancer, we never know for sure what's going to happen, because there's a saying in veterinary oncology, and that is cancer can do it at once. But the majority of mast cell tumors are low grade. If we can surgically remove a low-grade mast cell tumor, we've typically cured the patient of that particular mast cell tumor. That doesn't necessarily mean that they won't go on to develop another mast cell tumor in their skin at some other point in their life. In fact, 30% of patients that develop one mast cell tumor will go on to develop another one. How do we know if it's low grade, and how do we know if it's completely excised? Well, the only way to know the answer to both of those questions is with a biopsy. A biopsy is when we remove the tumor or part of the tumor and we send it to a pathology lab. The pathologist then looks at that tumor under the microscope and describes the microscopic characteristics of that tumor. There are certain microscopic characteristics that will put a mast cell tumor in one category or another. So I need to know, is it cutaneous or subcutaneous? I need to know if it's low grade or high grade, and I need to know if it was completely excised. So cutaneous versus subcutaneous. Cutaneous means the tumor is confined to the upper layers of the skin. It doesn't dive down below the microscopic layers of the skin or the dermis. Your skin is made up of different layers, and if a mast cell tumor is truly confined to those upper layers, it's considered cutaneous. If a mast cell tumor is found underneath of those upper layers, it's considered subcutaneous, and the majority of subcutaneous mast cell tumors are cured with surgical excision. Now, if we have a cutaneous mast cell tumor, I need to know if it's low grade or high grade. Low grade cutaneous mast cell tumors are very unlikely, not impossible, but very unlikely to spread to another location or to come back after the surgery. Unfortunately, high-grade cutaneous mast cell tumors are very likely to come back somewhere in the body, even if the primary tumor was completely excised. So what do I mean by complete excision? Well, I'm looking at what kind of margins did we get around the tumor. And there are three categories for margins. There's clean margins, which is what we want. There are narrow margins, which we might be able to live with, and then there are dirty margins. So most tumors that you can see and kind of get your hands around or measure, a lot of them are kind of tips of an iceberg. Not as dramatic, but kind of. I mean, it paints a picture. So there's the part of the tumor that you can get your hands around, but then microscopically around that, there are little satellite cells that kind of radiate out from the tumor. And whenever we're planning on removing something that we think is cancer, we want to make sure we're removing those satellite cells. If we leave those satellite cells behind, and sometimes that's inevitable because of the location of the tumor, there's only so much skin you can remove in certain areas. But if some of those satellite cells are left behind, sometimes there's a decent chance they will grow into another tumor. Now, that chance is kind of so-so for subcutaneous mast cell tumors, and even for some low-grade mast cell tumors. High-grade mast cell tumors will almost certainly come back if we don't get all of those satellite cells out. So when we're looking at margins, we typically define clean margins as having about 5 to 10 millimeters of clean tissue all around the tumor that we can see microscopically. Narrow margins means there is clean, normal tissue around the tumor, but we only got about 1 to 2 millimeters maybe. And then dirty margins means we can see tumor cells right up against the edge of that biopsy. So if your dog has been diagnosed with a low-grade or subcutaneous mast cell tumor that has been completely excised, we're typically done there. We ask that you monitor your pet for any new growth, and anytime a new growth is found, it needs to be tested to make sure it's not another cancer. If your dog has a low-grade or subcutaneous mast cell tumor that's been removed with narrow margins, we might be done. I don't always recommend additional care after surgery for those low-grade or subcutaneous mast cell tumors with narrow margins, but it might depend on the situation. If this pet has developed 6 mast cell tumors in her lifetime and this is the 7th, then maybe I will institute some therapy to try to prevent that pet from not only developing a recurrence of the tumor that we just removed, but hopefully prevent him or her from developing more mast cell tumors. More on that later. If we have a low-grade or subcutaneous mast cell tumor that's been removed with dirty margins, it would be ideal to probably go back in surgically if possible and remove more of that tissue around the scar. Now, is that absolutely necessary? No. I mean, even with dirty margins, low-grade mast cell tumors don't always return, but they could. Now, why do I care about that? If you remember a little while ago, I said sometimes these mast cell tumors will pop up under the skin and never cause a problem. They could sit there for years and just sit there. Well, some of them also can change into a high-grade mast cell tumor. And if that happens, they're much more difficult to get under control. So that's why we're typically recommending that any mast cell tumor be dealt with as soon as possible before these bad things could happen. But what if your dog has been diagnosed with a high-grade mast cell tumor? Fortunately, with high-grade mast cell tumors, whether you remove them completely or not, they're very likely to return. Now, they can return at the surgery site where they were removed, or we can see them show up in a lymph node that was near the surgery site, or the liver or the spleen. So these high-grade mast cell tumors will often show up in other places in the body. Usually within weeks to months of that happening, if we're not treating the pet, they get very sick. So the tumor itself can become big and painful, press on nerves, cause inflammation. Sometimes they become open and infected wounds. And again, those chemicals that they're releasing can have body-wide effects: low blood pressure, nausea, vomiting, diarrhea. Essentially, they significantly affect the quality of life of the pet. So is there anything we can do to help patients with high-grade mast cell tumors? Well, yes, there are several things that we can do to try to put this cancer into remission and help a patient feel well for as long as possible. Sometimes we are very successful. We are able to put patients into remission for a couple of years, sometimes longer. That's very rare. High-grade mast cell tumors are very aggressive. Most of the time, what we're able to do is put a patient into remission for some temporary period of time. That temporary period of time is different for every pet and can range from anywhere from 3 months to 18 months. Very rare that we will completely cure a patient of a high-grade mast cell tumor. Even if we can achieve a long-term remission, at some point that mast cell tumor usually comes back. So how do we treat this? Well, in my practice, I'm typically treating dogs with oral medications. I'm typically using something referred to as targeted therapy, which is different from chemotherapy, even though they both treat cancer. So chemotherapy goes into the body and kills rapidly dividing cells indiscriminately, whereas targeted therapy targets a specific growth pathway that is upregulated in the cancer cell. So all cells have growth pathways. That's how cells survive. That's how they divide when they need to. That's how they become whatever it is they're going to become, a skin cell, a liver cell, a brain cell. But these pathways are supposed to have regulations, checks and balances. They're not just supposed to be turned on all the time. In cancer cells, these growth pathways are not only turned on all the time, but there's usually too many of them. So it only takes a little bit of a signal for that growth pathway to get out of control. Targeted therapies target these growth pathways and turn them off. Nowadays, we're able to know which type of pathway is turned on in which type of cancer. They're all different types of growth pathways, and there are different types of drugs that can turn off each pathway. Fortunately, in veterinary oncology, we now know, or we can test for, which pathways are turned on in each individual dog's cancer so that we can be very precise with their treatment. Now, in mast cell tumors, there are a handful of medications that are potentially effective. I usually start with one, and if that doesn't work or is not well tolerated, I will try the other one. Fortunately, these drugs are usually well tolerated. I would say roughly somewhere between 50 and 75% of patients do not have any negative side effects. And when they do, we can see things like a decrease in energy, a decrease in appetite, vomiting, diarrhea. But if we see that, we're going to change the plan. We can lower the dose of the drug. We can swap one drug out for another. We can change the frequency. There are a lot of ways to change the plan to make sure that our patients are having a very good quality of life while they're going through treatment. Now, I would consider this type of therapy direct cancer treatment. These are medications that are designed to inhibit cancer cell growth. But is that the only way we should be treating our patients? No, I don't think so. I think we need to take into account the whole body, not just the tumor itself. When I chat with families, we talk about optimal nutrition, maybe some supplements that a pet should be on, specifically how to decrease inflammation and maybe optimize the immune system's ability to fight cancer, because cancer is, a disease of the immune system. So we want to make sure that we are really setting that patient up for success. It's not just a matter of giving some pills to treat cancer. We need to make sure their whole body is healthy and able to tolerate these medications and be able to utilize these medications to their fullest potential. Now, nutrition and supplements, these are topics I love to talk about. I can go on and on about them, and they are for a different video. Another medication we can use to treat dogs with mast cell tumor is called gilvetmab. Gilvetmab is in a category of medications called monoclonal antibodies. And monoclonal antibodies can unleash the natural power of the immune system. Now, it's the immune system's job to see cancer cells and destroy them. The cancer cells are pretty clever, and they have this ability to create a force field around themselves that protect them from being seen by the immune system. Now, gilvetmab can sort of release that force field and allow the immune system to see the cancer, and then it can just do what it naturally does, go after cancer cells and destroy them. what if your dog is one of the 30% of dogs that continue to develop mast cell tumors over and over and over again? So either every few months or maybe even every few years, they're developing another mast cell tumor, sometimes multiple mast cell tumors at a time. Should we continue to perform surgery and remove all of these tumors? Maybe, maybe not. It sometimes gets to a point where we're essentially playing surgery whack-a-mole with these tumors, and that is a situation where I might reach for gilvetmab. Another medication we can use is called Stelfonta. Stelfonta is injected directly into the tumor, and it destroys the tumor from the inside out. It kills the tumor and causes it to fall off of the body, and then a wound is created there, and then the immune system does its job and patches up that wound. Another thing I try to do for patients, especially ones with multiple mast cell tumors, is decrease inflammation. So I do see dogs who have chronic skin allergies develop multiple mast cell tumors, and while it hasn't been a proven way to prevent mast cell tumors from developing, I still try to decrease that inflammation, because what has been proven is that chronic inflammation is a carcinogen, and a carcinogen is something that can eventually lead to cancer. So chronic inflammation can lead to cancer development. There are a lot of ways to decrease inflammation in the skin. If your dog has chronic allergies, I recommend seeing a dermatologist. They have their own ways of dealing with and treating and controlling allergies, which will in turn control inflammation. There are also general ways to try to decrease inflammation. That's a big topic, and we will definitely talk about that in another video. And another way we can help patients deal with these mast cell tumors is by decreasing the mast cell tumor's ability to affect the body. So remember I said that the mast cells themselves contain these granules, these little bags of chemicals, namely histamine, which causes a whole bunch of problems. We can give antihistamines to help these patients. So the antihistamines don't fight the cancer directly, but they fight what the cancer is doing to the body. So they block that histamine from connecting and causing issues. So antihistamine drugs like Benadryl or Claritin are good antihistamines for the whole body. And then a drug like Pepcid, which is sold as an antacid, is actually an antihistamine specifically for the stomach. So it blocks histamine connecting in the stomach, which then reduces acid production. Now I know we've covered a lot in this video, but if your dog has been diagnosed with a mast cell tumor, especially if it's high grade, I encourage you to reach out to a veterinary oncologist. Having a consultation with a veterinary oncologist does not commit you to one treatment or another. It doesn't even commit you to any treatment. But I do think that you will find that information very valuable. Knowledge is power, and the more knowledge we have, the better equipped we are to make the best decision for our family members. Now, what if you're one of the millions of Americans who do not have easy access to veterinary oncology? How do we help them? Well, I am able to consult with pet parents no matter where they live. I do this via Zoom, sometimes through a phone call. I will review the medical record, and I will chat with you about what your local veterinarian has already done and what diagnosis has already been established. What I can't do outside of the state of Washington, or really via Zoom anywhere, is make a diagnosis myself or prescribe any medications. But I can help you understand the diagnosis, what that means for your pet, and what you might want to consider as additional diagnostics, or maybe we're ready to jump into treatment. If your local veterinarian is up for it, I can provide him or her with written, comprehensive treatment guidelines that they can use to implement a cancer care plan wherever you live. So if you live in Yakutat, Alaska, or Jackson, Mississippi, where I know there are no veterinary oncologists, you can still get the help that your pet needs. So if you would like to speak to me or another virtual oncologist out there, chat with your local veterinarian to see if that's something they can help you set up, and I'd be happy to chat with you about your dog's diagnosis. Cancer sucks, but in many cases, there is hope. Don't be afraid to get the information that you need. Again, my name is Dr. Vanessa Rizzo. I'm with Hope Veterinary Oncology Services. and we bring veterinary cancer care closer to home.